The effects of strength training on the physiological determinants of middle and long distance running performance was explored by Richard Blagrove and colleagues in their systematic review published in the journal Sport Medicine. 24 studies met their inclusion criteria, which was that heavy resistance training, explosive resistance training or plyometric training lasting 4 weeks or more was undertaken by participants that had 6 months or more experience in middle or long distance running, but were not strength trained. Studies had to include a running only control group and also report data on one or more physiological variables. This presentation, brought to you by Talking Sports Science, will provide a summary of their findings and recommendations. Regarding the results, strength training generally led to a 2 to 8% improvement in running economy compared to a running only control group, and 1.5 to 10 km time trial performance and anaerobic speed qualities also tended to improve following strength training, whereas VO2 max and velocity at VO2 max and blood lactate and body composition were typically unaffected by strength training. We'll now look at the recommendations for strength training prescription. Due to adaptations being specific to the demands placed upon the body, determining the most effective type of strength training was difficult to establish. For example, heavy resistance training is characterized by slow velocities of movement and is likely to improve agonist muscle activation, whereas explosive resistance training involves moving lighter loads more rapidly, which tends to enhance firing frequency and therefore improve rate of force development. And for plyometric training, this develops stretch shortening cycle efficiency and uses movement patterns which closely mimic the running action. Therefore, in the long term, a mixed modality approach to strength training is recommended, as this provides the variety and continual overload required to ensure the neuromuscular system is constantly challenged. Regarding the strength exercises selected, free weights that require force to be generated from the leg extensor muscles in a closed kinetic chain position, such as the barbell squat, deadlifts, and step-ups and lunging movement patterns are recommended, as these exercises have a greater biomechanical similarity to the running action compared to machine or single joint exercises, so are more likely to positively transfer to running performance. For explosive resistance training, Olympic weightlifting derivatives are recommended. And to maximise transfer to distance running performance, particularly at faster speeds, plyometric exercises, which possess a low to moderate eccentric demand, are recommended. Example exercises include depth jumps from a 20 to 30 centimetre box, hopping and speed bounding. To promote a rapid contraction and improve muscular tenderness stiffness, these exercises should be executed with short ground contact times, for example less than 0.2 seconds, which is similar to the contact times observed in competitive middle and long distance running. Moving on to volume and intensity. Regardless of the training modality, most of the studies reviewed initially used 1 to 2 sets, which progressed to 3 to 6 sets over the course of the training period, with 2 to 3 minutes recovery between sets. For non-strength trained individuals, this gradual progression is important to help mitigate against the risks of injury and overtraining. Regarding resistance training, a low repetition range of between 3 to 5 reps used in every heavy resistance training session at loads of 80% 1RM or above, or repetition failure did not provide superior benefits when compared to studies that prescribed higher repetitions ranging between 5 to 15 reps using moderate loads, for example between 60 to 80% 1RM. In the reviewed studies, sets were often performed to repetition maximum, likely as a means of standardizing intensity in the absence of 1RM data. Performing sets to repetition failure induces a high level of metabolic and neuromuscular fatigue, which may delay recovery. This is unfavourable and unnecessary to optimise gains in strength compared to a non-repetition failure strategy. Participants were often instructed to move the weight as rapidly as possible when performing the concentric phase. This is recommended to help maximise neuromuscular adaptations. Compared to running and resistance training, plyometric training is characterised by high eccentric forces. Therefore, repetitions per set are typically low. In the studies reviewed, this ranged between 4 to 10 reps per set. For total foot contacts, this progressed from 30 to 60 repetitions in the first week of training, up to 110 to 228 repetitions after 6 to 9 weeks. 23 out of the 24 studies reviewed performed plyometric exercises without any additional external load, and in many cases a short ground contact time and maximal height were cued to amplify the intensity. Moving on to frequency and duration, the addition of 2 to 3 supervised strength training sessions per week over a 6 to 14 week period is likely to provide a sufficient stimulus to improve endurance performance, and benefits are likely to be larger for interventions of a longer duration. For example, 6 weeks of strength training improved time trial performance by 2.4 to 2.7%, whereas longer strength programs of between 8 to 11 weeks resulted in larger improvements of between 3.1 to 5.5%. For highly trained distance runners, it would appear that over the short term, for example between 6 to 9 weeks, they don't require a higher number of strength sessions to achieve the same benefit in run economy and time trial performance as less experienced runners. When planning the number of strength sessions, runners can decrease their lower limb strength training frequency from between 2 to 3 sessions per week in the preparatory phases of training to a single session each week during the competitive season, as a single session a week is sufficient to at least maintain previous gains. To help achieve sufficient strength gains without compromising running training, at least 24 hours recovery between a strength training session and an intensive running session is recommended, and after high intensity running training, a recovery period greater than 3 hours is recommended before strength training takes place. Therefore, for non-strength trained runners, a variety of strength training modalities can be used to achieve similar outcomes. However, to maximise long-term adaptations, a periodised approach is recommended, with heavy resistance training being prioritised initially. Although changes in fat-free mass were not observed in the majority of the studies, a targeted resistance training program which aims to increase muscle mass specifically around the proximal region of the lower limb is suggested, as it may enhance biomechanical and physiological factors which positively influence run economy. And that concludes this presentation. Go and check out the full article, the link is in the description, especially Table 2, as it provides a breakdown of what type of strength and running training was actually completed in each of the 24 studies included within the review. Thanks for listening, folks. See you next time.